So hello. Hello. Good afternoon. So nice to meet you again. Today we had a nice live transmission to Brazil, but I want today to show you something that I believe can be applied in a easier way in your units when you have this kind of patient. So we have a 42 years old woman with a history of GERD. She has been under treatment of PPI double doses, but she have a you see the sphincter is well, the tonus is well. In spite of this, she have reflux disease. So she came because she had some low grade dysplasia under a small Barret esophagus. I will show you a little bit. So now I am using a MagniView scope. So this is the area. This is one of the area. This is the other one, a small one, right? Just here. And we have here a small one here. You see? So what I will do, I don't see any low-grade dysplasia. I don't see microvessels or neovascularization for the moment. So probably the PPI treatment was very good, and that's why now the patient is doing well. But well, she doesn't want to be with this nightmare of Barret esophagus, and I believe one of the treatment of choice is to remove this Barret esophagus and then to try to make a ARMA, argon plasma for reflux disease, right? Under endoscopy. So that is what I will do now. I will put some. ¿Tenemos ácido acético? So I will put some acetic acid because I want to see very well. I will change the scope. I will not do my my resection under using a magnification scope. It's better to use a standard scope, high definition. So my assistant is preparing everything. I will put just okay. So now, un momento. Dale. Ok, un momento. Sigue. Un momento. Aquí, sigue. Un momento. So, I like to use acetic acid, you can see here. So we can see very well the areas. Okay, so and in this way, I believe, so you have two ways of treatment of this Barret esophagus. First one is radiofrequency, and second, using captivator EMR. So I prefer the captivator because I have three areas, and second, I can, this patient had history of low-grade dysplasia, so I prefer to remove the whole tissue and send to evaluate it. And then I will do ARMA with the same scope. I will show you how we do it. And I think it's a very good option of treatment for this kind of patients. See. So we are preparing the captivator. Let me see. Moment. Okay. So now we are fine. No tengo aspiración y no tengo CO2. ¿Está bien puesto esto? Ok. Apaga un ratito la luz. El hilo es como que no lo veo bien. Ahí. Okay, so let's go. Now I will pass the captivator. I like it because it's very conic, and at the same time I don't have this problem of I can see very well. I don't have the problem to have the band. So now I will make the resection of the areas. I will start here. So we don't need to okay, dame la. So I will remove with the with my snare. So why to do the remove of this lesion is better, because I don't need to come back to continue follow up for this Barret esophagus, and the risk diminish. Abre todo. Okay, so now I have cierra despacio. Okay, so now I will cut here. So now you see, we remove it. Perfect. Now I will remove this area, this small area. And now we'll cut. Abre. You see, we can see the acetic acid very well. Está abierto. Okay. So now I need to catch this lesion. So cierra despacio. So we got it. Perfect. And then I will recover it. Well, let me see if I can recover this. Okay. So now I will cut this third one. The third area. So we almost remove everything here. So I want to see very well. It's here. It's a small area. Okay. So now I will remove this. Abre. And I will cut. So this is a simple treatment. It's a nice device also. I like it because we can, cierra, espacio. Cierra, 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 cierra. So we have it. No importa. So now, okay, abre, retira, no retira esto. So I believe I finish here. I need now to make I need to evaluate now how was my cut. I believe it was good. I need to recover the other part. Okay, there's a bleeding. It's okay, it happens. Okay, now I need to recover my other area. Estoy transmitiendo. So now perfect. So I will remove everything. I will remove my cap, and I will use the same scope, and I will stop the bleeding, and then to make the ARMA treatment. Sí, sí, sí. Me prestas la pinza de laza y la conectas porque voy a cauterizar. So now I will use the same, snare that I use it because I want to see where it's bleeding now. I think it's in the last one. So you see, we remove here. Very good. And here is bleeding. Here's the bleeding. Okay. So the risk of perforation is low when you are using this device. A little bit low. Abre. Quiero ver la punta. Retira. Está muy abierta la punta. Más, retira más. Ahí está perfecto. Ok. Está conectado. So let me see again. It's very good. So you see, I remove this, and this area. Very well. I think it's not more bleeding. I believe it's not more bleeding. So now I am ready. So you don't need to use, more anything. So now I will make an aspiration, and I will show you the ARMA technique. So how we will do that? We will use, ¿qué? No, ¿para qué? It's very important to have very clear this area, you see? And now I will make my treatment. So now, so I need to make a 220 degrees, and I want to show you how we do it. So normally I use Blue Boost. It's a hyaluronic acid because I can burn much better and much high power when I am doing the ARMA technique. Okay. So we need to go until 3 centimeters. Momento. Ok, abre. Está abierto. Ok, inyecta. So you can see I am injecting. The Blue Boost is hyaluronic acid. So I prefer to do it. It's not expensive, not too much expensive, but this is safe. Sigue, para, retira. Ok, abre, inyecta. Inyecta. Para, retira. Abre. Inyecta. Inyecta. Para, retira. Abre. Inyecta. Para, retira. Un momento. Abre. Inyecta. Sigue. 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 Para, retira. Abre. Inyecta. Para. Inyecta. Momento. Abre. Inyecta. Sigue. Sigue. Para, retira. Abre. Inyecta. Para, retira. Now I need to go to this area. Okay. Abre. Un momento. Inyecta. Sigue. Sigue. Sigue, sigue, sigue. Para, retira. So now the last degree. Okay. momento. Abre. Inyecta. Momento. Inyecta. Sigue. Para, retira. Para. Abre. Inyecta. Para, retira. So I think we are fine now. A little bit more. I want to go here. Okay, abre. Inyecta. You can see. So it's very important to have this 220 degrees. I like it to do it very well. Inyecta. Okay. Ok, terminamos. Para. Okay, ahora sí dame el argón. So now I will use argon. You can see. You can use saline solution if you want, but I believe, you know, the hyaluronic acid is much better because of so now okay, and now we will use the argon plasma. I start very near to the sphincter. There are some authors that say we need to respect the sphincter. I believe if you are okay, so you can be borderline, to my opinion. I'm not so sure about that, you know. So I am burning very well. I am using force coagulation 4. So we need to evaluate, still evaluate, what are the results of ARMA in patients maybe with hypotension sphincter or with normal sphincter by manometry and pH metry showing reflux disease, right? So this is one of our studies that we are doing now to evaluate the real clinical effect of this technique in patients with GERD. So I am almost finished. Let me see. A little bit here. So I believe we're done. Okay, let me now to see here. No, quiero ver si tengo que hacerle algún cargo. So I want to see if there is still bleeding or not. Toma. If there is still bleeding, we can make some argon plasma here also and stop the bleeding, okay? So you can see here, so this is the area that was resected. I don't see any more area and I remove everything. So I finish. Thank you so much. I believe we are done here. And let's see what the result says with pH metry, right? Very important.